Well, welcome back for another special edition of Healthline 3. If you are watching us online right now, you're going to see a Healthline 3 box on the right-hand side of your screen. Remember that you can submit your questions there online, or you can call us at 318-219-4569 and talk live with the doctor. And speaking of the doctor, we are talking with Dr. Mark Mainous. He is a general surgeon at Willis Knighton Piermont. Welcome aboard.
Thank you.
Do you feel comfortable? Do you feel good in front of the camera?
I do.
You do? Well, look, I love your smile. You look happy to be here. We are excited to have you and to talk about something that's so important like gallbladder disease. Tell me a little bit about this.
Well, the reason I wanted to talk about gallbladder disease is it's one of the most common diseases in America that requires surgery to take care of. And it's about probably 10 to 15% of Americans will have gallstones, and up to 30% of women will develop gallstones by the age of 65. A lot of those cases will be asymptomatic and they don't need surgery, but once the symptoms start, the symptoms typically become more frequent, more severe over time, and it can just make people miserable.
Absolutely.
And we have the surgery we do it can just change their life.
Now, we've talked a little bit about laparoscopic surgery before and that method for treating it in surgery. Mm-hmm. Tell me a little bit about that. When a patient does realize that they have these stones, what's the next step?
Well, they need to be worked up. Typically, a patient with gallbladder disease will have pain up under the ribs on the right side, frequently radiating through to the back, occasionally up into the right shoulder, associated with bloating, and in more severe cases, nausea and vomiting. The attacks usually occur after eating a fatty meal, fried foods, fatty foods, but as the disease progresses, they can get sick after any type of meal.
So very painful. Obviously, you want to get this removed.
Right, and so the first step is to document that it is gallbladder disease, and typically what we do is we get a gallbladder ultrasound, and that'll show if they have stones or wall thickening or any other abnormalities of the gallbladder. But there are really two different types of gallbladder disease. There's gallbladder disease caused by stones, and there's gallbladder disease that's caused by a malfunctioning gallbladder. And just because they have a negative gallbladder ultrasound doesn't mean they don't have gallbladder disease, and that's a common misconception. I see a lot of patients who have classic symptoms of gallbladder disease, but the gallbladder ultrasound doesn't show stones, and so they're told that there's nothing wrong with them. Well, there's another test that I get if their gallbladder ultrasound is negative, and that's called a HIDA scan, and that looks at the functionality of the gallbladder. And the way that works is they'll inject a substance initially that shows up on a camera, and it's taken up by the liver and excreted into the bile system. So you see the liver light up, then the bile system, and then you'll see the gallbladder light up. Now, if the gallbladder doesn't light up, that means the gallbladder is blocked off, and that's an abnormal test, and that means their gallbladder is diseased. But if the gallbladder does light up, they'll wait for it to fill up, and they'll do a second part of the test where they give them a substance called cholecystokinin, or CCK, which is the exact same substance that your body produces after you eat a meal, and the only known function is to stimulate the gallbladder to contract. And once they do that, they can calculate what's called an ejection fraction, which is what percentage of the volume the gallbladder squirts out with a smooth contraction. And it should be greater than 30%. And if there's a low ejection fraction, that means that it's not 100% diagnostic, but if they have the classic symptoms and a low ejection fraction, that's indicative of gallbladder disease. And another thing that I tell patients to pay attention to is if they have reproduction of their symptoms during the second part of the test, because if they have pain and nausea after the CCK is given, that's a pretty good indication that the gallbladder is causing the problem, because the only thing that substance does is cause the gallbladder to contract, and it basically simulates a fatty meal.
Do we know what leads up to this? Is it your diet and exercise, or is this just something with age and time?
That's a good question. In most cases, nobody knows. I can tell you that
is anyone at greater risk?
Well, not really. There's three things that will predispose people to gallbladder disease. Some people have a strong family history of gallbladder disease. Pregnancy can cause gallstones to form, and we see a fair number of pregnant women who have pretty symptomatic gallbladders during pregnancy. We try to ride them out through pregnancy, but sometimes we have to operate on them.
Wow.
And the
I
third,
can imagine that's got to be incredibly difficult with a baby in there.
Yeah. And then people who undergo bariatric surgery or have rapid weight loss, they're predisposed to forming stones. But aside from that, the vast majority of people, we don't know why they develop gallbladder disease. It just happens.
Let's talk a little bit about the treatment and when you finally decide, okay, it's time to go in and fix this or remove this. If you have gallstones or gallbladder disease, what can you do?
Well, it's really a pretty simple, straightforward operation. We do what's called a laparoscopic cholecystectomy. I use a laparoscope that is about the size of a drinking straw. It's smaller than a quarter of an inch in diameter. And I make a little 1/4 inch incision at the belly button to put the scope in, then about a 1/2 inch incision right below the breastbone for this instrument which takes the gallbladder out, and then 2/4 inch incisions below the ribs on the right side for instruments which we use to grab the gallbladder and move it around. And the gallbladder is attached, it's attached to the undersurface of the liver, and then there are two structures that have to be divided before we can take it out. One is the cystic duct, which connects the gallbladder to the main bile duct, and the other is the cystic artery, which is the blood supply from the main artery going to the liver. So we free up those two structures, divide them, and then peel the gallbladder out from underneath the liver, put it in a bag, and pull it out. And it usually takes about 20 minutes to do that.
That sounds so quick and easy. I guess because you've been doing it so long, you've got it down to a science.
I've done thousands of these. Yeah.
Let's talk a little bit about that in your history, and let's kind of boast on you for a little bit. You've been a surgeon for how long now? It's been too long when you know you got to do that. When you got to, that's like me with my age. Like,
it's been over 30 years.
Look at that. And you've done quite a few fellowships as well, and all of this, your background and training has really been able to really assist you in what you're doing now. Let's talk about that.
Well, I did when I did my residency here in Shreveport, and then I originally wanted to be an academic trauma surgeon, so I went to University of Texas Medical Branch in Galveston and did a burn fellowship at the Shriners Burn Institute through the Division of Plastic Surgery, and that was good for me because I got to do a lot of plastic surgery in addition, and that I learned how to properly close incisions and do flaps and things like that, and that's really helped me with my practice as far as making incisions look good.
Yeah, let's talk a little bit more about that. When you're doing laparoscopic surgery, using the laparoscope, that can obviously cause or create some sort of severe physical, disformity or a look that's not aesthetically pleasing. Why is it important to have that plastic surgery background?
Well, I just, it enables me to do a nice job closing those incisions. Anytime you make a surgical incision and close it, the incision is going to be a little bit red, raised, and firm for about 6 or 8 weeks, but after that it'll soften up, flatten out, and fade away. And if it's properly closed within 3 or 4 months, it ought to be pretty hard to tell that anything was ever done.
Look at that. I want to leave it looking nice and pretty,
yeah,
on top of trying to help and fix people.
Right.
You also have a background in fly fishing.
Right.
How does that kind of parlay into what you do?
Well, actually, I don't think fly fishing helps my surgery, but my surgery helps my fly fishing and particularly my
That's
fly
always
tying.
Important. Hey.
Yeah, I love to tie flies, and my surgery background helps me with that.
Look at that. So this is your other side of you, the side that needs to just be relaxed and calm and not have the brain going too hard.
Right.
I love it. Let's talk again a little bit about gallbladder disease. Why is it so important that we talk about this, and why do we see so many cases?
Well, I mean, I think it's important because there's a lot of people out there who are just miserable and they don't know they have gallbladder disease. And it's amazing how much better they feel after they have their gallbladder removed, if the gallbladder is causing them a significant problem. I've had people who come into the hospital with what we call acute cholecystitis, where they have a sudden severe attack of pain and they're just in horrible pain, and they'll wake up in the recovery room and they immediately feel 100% better.
Wow, so just a big change just like that within
Right.
a matter of 20 minutes of
Right.
a surgery that you performed. Is there anything that you recommend that can help prevent leading up to this point?
Well, I mean, if somebody, I'm not sure there's anything that you can do to prevent gallbladder disease from occurring. It just happens. But if you become symptomatic and want to avoid surgery, the best thing to do is try to avoid eating fatty foods. If you can minimize the amount of fat in your diet, you can minimize the symptoms, because it's really the fat content of the meal that stimulates the gallbladder to contract.
All right, I believe one of my buddies is also a surgeon that deals with the gallstones, and he mentioned to me vitamin C is something that you tend to see more cases of gallbladder disease. Is that accurate with the consumption of vitamin C?
Honestly, I don't know the
We don't
answer
know?
to that.
Okay, we'll stay away from that one then. What should a person do to kind of look out for the symptoms? How do you know, or for yourself before even going to a doctor?
Well, as I said before, the classic symptoms are pain up under the ribs on the right side after eating a meal, particularly a fatty meal. Now, occasionally people will have pain in what we call the epigastrium, which is the pit of the stomach right in the upper center of the stomach. Oftentimes the pain will radiate through to the back or up into the shoulder. There's frequently bloating after eating, and in severe cases people actually have nausea and vomiting. So those are the classic symptoms of gallbladder disease.
Can it be mistaken for gas or heartburn?
Oh, absolutely. And there's a lot of times it's really not straightforward. And a fair number of my patients will be evaluated by a gastroenterologist before being sent to me to try to sort things out, because there's a number of other conditions that can cause similar symptoms, particularly irritable bowel syndrome and peptic ulcer disease, things like that. So,
but the big thing to look for is that sharp shooting pain that's kind of going up through the back, because that's unique.
well, it's mainly pain up under the ribs on the right side or in the pit of the stomach. It doesn't always radiate, but typically you'll have pain. The pain will start in the right upper abdomen.
All right, now I'm beginning to worry, because I know I've gotten pains before after eating a meal. Typically, what age do you start to see this happening in people?
Well, I've seen it as young as late teens, early 20s. Wow. In general, though, it's usually in the 30s and 40s when people start having symptoms.
Are people overweight? Do they have an unhealthy lifestyle?
Classically, people will be overweight, but it's amazing how many people who are healthy and lean who will have gallbladder disease. It affects all types of people.
It has no labels, no
Right.
names, and it doesn't shy anybody away from that. When is it important for them to try and come and see you? What would be kind of their next step? They find the symptoms themselves, they sort of self-diagnose, they go to their physician and mention this. What would be the next step?
Well, next step is to be evaluated.
Can they go straight
with
to you?
imaging studies? I mean, sometimes they'll come straight to me. Usually they're already worked up by the time they come to me, or they're partially worked up. But like I say, the first step, if gallbladder disease is suspected, is to get imaging studies, and the first imaging study is an ultrasound. And if that's negative, the next step would be a HIDA scan. And if both of those tests are negative, then they really need to see a gastroenterologist to rule out other problems. There's a fair number of people. Well, ultrasound and HIDA scan are extremely accurate, but they're not 100%. And every now and then, you'll have a patient who has classic symptoms but negative studies, and I'll send those people to a gastroenterologist to rule out other causes. And sometimes we'll end up having to operate on those people if everything else comes back negative.
All right, and Dr. Mark Mainous, I don't want to cut you off, but you already have your first caller on the line, and I believe Lisa has a question for you today. Good morning, Lisa.
Good morning. I recently was diagnosed after taking a HIDA scan. I got the results yesterday that my gallbladder is working at only 23%. They didn't mention any stones. I had no pain during the test, and does that mean that I have to have surgery? And the second question is, does the gallbladder affect the acid reflux that I have?
Well, the decision to perform surgery really is dependent on how bad the symptoms are. Just because there's a low ejection fraction on a HIDA scan doesn't necessarily mean that the gallbladder's the problem. It really depends on the severity of the symptoms. And acid reflux is a totally different problem. A lot of people with gallbladder disease also have acid reflux problems, and they're treated totally differently. And taking care of one problem doesn't necessarily take care of the other problem.
Okay. All right.
Does that answer all of your questions today, Lisa, or do you have anything else?
That's if I leave the gallbladder in and it's only functioning at 23%, does that have any effect on my health? Or?
As long as it's not causing symptoms of gallbladder disease, it doesn't affect your health at all.
So it's
functioning at 23% is not gallbladder disease?
Well, it doesn't necessarily mean that the gallbladder is diseased. The test is only helpful to confirm gallbladder disease in people who have typical symptoms of gallbladder disease, and if you have symptoms of gallbladder disease and you have a low ejection fraction, that indicates gallbladder disease that might benefit from surgery. But if just the mere presence of a low ejection fraction doesn't necessarily mean that the gallbladder needs to come out.
I see. Okay, thank you.
You're welcome.
all right. Thank you for calling in today, Lisa. Okay, so she said that her gallbladder was only performing at 23%.
Mm-hmm.
So is it still functioning? I guess it's still performing and doing what it needs to do?
Right, and what you have to understand is that's just one point in time. I mean,
when the test was taken.
Right, there's all kinds of different reasons that the gallbladder may not function normally
at 100%.
At a point in time, and so it's real important that you take care of. I mean, they have to be having symptoms of gallbladder disease. You never treat the results of a test.
I gotcha.
You treat the patient.
You need a little bit more. We need to go a little more in depth before we go in and just start taking that out.
Right. I mean, the test is done to confirm your suspicions of gallbladder disease, but I never operate on a test. I operate on the patient.
You want to go deeper into it. And speaking of going deeper into it, we have another caller on the line. Shirley, I believe, has a question for Dr. Mainous. How are you doing today, Shirley?
Thank you very much. I'm doing all right this morning. Thank you so much. Yes, my question to Dr. Mainous is, I have been told that I have gallstones, and I don't know if I really want the surgery, but I also have, like heart disease and asthma. And I was wondering, are there any other treatments for gallstone instead of surgery that could help me?
Well, unfortunately, there aren't any other treatments other than surgery, but just because you have gallstones doesn't necessarily mean the gallbladder needs to come out. In people who, well, first of all, I see a fair number of patients in my office who were sent to me just because gallstones showed up on a test. And if they don't have any symptoms at all, I don't take their gallbladder out. Now, if somebody is having symptoms and they do have gallstones, but they have some significant underlying health conditions, if their symptoms are relatively mild and tolerable, I think it's reasonable to leave the gallbladder alone. But if they get to the point where they just can't eat and they're miserable, then it'd probably be a good idea to get the surgery done, and it can generally be, a pretty well tolerated operation, even in people with underlying heart disease.
And Shirley, I think the doctor was trying to get that next question that you had. What is it that you were mentioning?
Oh, that's about the treatment for gallbladder and gallstone instead of surgery. I believe that's the one, and everything, because it is. I mean, my gallbladder, where they were bothering me every day, and it's kind of miserable.
Yeah,
but I like the treatment.
Yeah,
Dr. Mainous said there was no other treatment.
Well, unfortunately, there really isn't any other good treatment other than take the gallbladder out if it's causing problems. There's no medicine that will really help with that.
But is that a day surgery?
Yes, ma'am. It's typically a day surgery. People come in, have surgery done, and go home the same day. And most people are back to normal within 5 to 7 days of the surgery, if not sooner.
Okay, 5 to 7 days. Yes, sir. Well, that's what I needed to know, and thank you, Dr. Mainous.
You're welcome.
All right, thank you, Shirley. And as Dr. Mainous was saying, it only takes 20 minutes just to perform that surgery, so it's an inpatient, outpatient, quick procedure there. And let's go kind of back to what you were talking about earlier. Just because someone has a test that shows that their gallbladder isn't functioning at 100%, that's nothing that you go off of to decide it's time to take it out. It's just one of the many phases.
Right. Like I was saying before, you never operate on a test result. You have to interpret that in relation to the patient.
All right, and it looks like you're very popular today. Joyce is on the line for you. Joyce, what question do you have for Dr. Mainous?
Hi. I have a question.
Yes, ma'am.
Okay. I wasn't sure if you heard me. I muted you. But my granddaughter had gallbladder surgery because she's very young, 32, and she had a lot of problems with extreme pain and a lot of other things. And then now that she's had her gallbladder taken out, she is still having sometimes extreme diarrhea. I mean, it's not just regular, and extreme pain in her stomach. Now, is this normal after gallbladder surgery?
No, ma'am, it isn't. I can tell you that about 20% of people will have short-term problems with diarrhea after surgery. It usually resolves after a week or two. About less than 1% of people, probably around 0.5% will have long-term problems with diarrhea. But as far as the pain goes, that's not typical. And if people are having pain after the gallbladder's out, there's probably something else going on. And it sounds like she may have irritable bowel syndrome or something like that. And if she hasn't had a gastrointestinal evaluation, it'd probably be a good idea for her to see a gastroenterologist.
Okay, because it's been a lot longer than that since she's had surgery, and she's still having the pain as well as the diarrhea. So it makes her really hard for her to even eat anything.
Right.
Oh, poor baby.
Okay.
So if she shouldn't come and see you, she needs to go see a gastroenterologist?
Right.
Okay. And I would assume, just in case, if she has any more questions for you, where can she find you at?
I'm at Willis Knighton Piermont, and my office number is 212-2846.
Did you get that there, Shirley? Or
yes.
Janice, I'm sorry.
Yes,
right.
I got it.
Thank you so much.
Thank you.
Did you have any other questions?
Thank you. No, that's it. Thank you.
Thank you for calling in. Oh, that sounds so painful. And to think that she's such a young lady at the age of 32 years old. It's not common that you see those kinds of symptoms after a surgery?
No, in fact, if they're still having symptoms after their gallbladder's removed, then there's something else going on.
Okay. Could it have been that she was improperly diagnosed to begin with?
That's a possibility. Another possibility is that she had two different things going on.
Okay.
It's not uncommon for somebody to have a bad gallbladder and irritable bowel syndrome.
Okay.
And
but the two don't always go hand in hand.
No.
All right, completely separate. You're getting a lot of questions. I didn't realize just how important of a topic this is, but obviously there's a lot of people that are impacted by this. And again, let's talk a little bit about just how often you see patients coming into your office and how you're able to help them.
Yeah, well, I see this every day. Like I was saying earlier, it's very, very common. Probably the most common problem I operate on.
Do you think any of it could be diet related, especially with the kind of diet that we have here in Louisiana?
Well, the diet probably doesn't cause the problem, but
it certainly doesn't help.
once they develop gallbladder problems, a high-fat diet just makes it worse.
Okay. And once again, some of the things to look out for, or things that you should maybe mention to your physician so that you can be, or they can be seen by you, would be what would you recommend for a patient?
Talking about
the symptoms, yes.
Yeah, just the pain up under the ribs on the right side after eating a meal, particularly a fatty meal or fried meal, bloating after eating, in more severe cases, nausea and vomiting. Those are the typical symptoms of gallbladder disease.
And once they do come in and they see you and they do that quick outpatient surgery, what is the likelihood that this gallbladder disease will return? Do they still have it, or is it completely gone because you've removed the gallbladder?
Yeah, right. Once the gallbladder's gone, the symptoms should be gone. And if they're still having some symptoms, then there's probably something else going on. And they'd need a gastroenterology evaluation.
So how important is the gallbladder if you could just remove it like that?
Well, what I tell people
is it like a kidney?
No, what I tell my patients is the gallbladder is kind of like the appendix. It doesn't serve any necessary function, and once it starts causing problems, it's generally best to get rid of it. What it does normally is it stores bile. The bile is produced by the liver. It's secreted into the main bile duct, which runs from the liver down to the intestine. The gallbladder hooks into the side of the bile duct, and when the gallbladder is working normally, instead of the bile going directly into the intestine, it'll take a right turn into the gallbladder, and the gallbladder stores the bile, and then when you eat a meal, signals are sent to the gallbladder and it contracts and squirts the bile out. But once the gallbladder is removed, the bile just continuously trickles into the intestines, and most people do just fine without a gallbladder. What the problem with diarrhea comes in when some people are overly sensitive to what we call the bile salts, one of the substances in the bile. And if you have a continuous flow of bile into the intestines after the gallbladder's removed, that can cause people to have problems with diarrhea. And there's a medicine called cholestyramine which will bind up those bile salts and help with that problem.
All right, that sounds incredibly painful from what we've heard people dealing with and some of the things that you have mentioned.
Yeah, it's amazing how such a small organ can cause so much
problems.
Misery.
Does it filter the bile?
No, it just stores the bile, and that's really and it helps maintain the bile in a liquid form, and that's really all it does. It doesn't do any filtering. It doesn't do anything essential.
Well, before we go, we have about 90 seconds left in the show. I want people to be able to find you and maybe call you and ask you any questions that they may have that they didn't feel comfortable calling in today. You're at Willis Knighton Piermont.
Correct.
Where can they reach your office at?
The phone number is 212-2846, and my nurse is named Shelley. Just ask for Shelley.
All right, and you guys are there Monday through Friday?
Correct.
All right.
I operate Mondays, Thursdays, and Fridays. I'm in the office Tuesdays and Wednesdays.
Do you do consultations for people?
Oh, sure.
All right, and they're able to do that without getting a recommendation or referral from a physician?
Right. They can just call up my nurse and we'll give them an appointment.
All right. Well, thank you so much for joining us today, Dr. Mainous. We really appreciated that. Got a lot of phone calls in here today, and you were able to help quite a few people.
So
hopefully your phone is probably going to be ringing off the hook, and your nurse is not going to like us for a little bit. But I'm sure Willis Knighton, of course, we thank them for allowing you to come on to our show. Anything else that we're missing this afternoon? I'm going to do it to you again like I did to you this morning.
No, I think it's been covered.
All right. Well, thank you so much for joining us
You're welcome.
today. And for
It's been a
everyone who
pleasure.
watched, thank you so much. Have a blessed and wonderful day. Remember, you can always talk with the doctors live during our Healthline 3 segments.